So let's talk about depression a little bit because I heard you
Yes.
mention it, and
Yes.
a lot of people are familiar with feeling anxious or worried, but your depression, I think, if you don't mind me saying, was quite severe.
Yes.
Now you had depression before, postnatal depression, hadn't you?
Yes.
How did you feel those symptoms began when you felt it coming on?
For me, it is perhaps anxiety type feelings initially, but it doesn't manifest itself in panic attacks or anything like that. I can usually get through the anxiety bit, but then it literally is that I do start to close down. I don't know how to explain that really. I probably, yeah, I do. I don't want to go and do things. I'm normally the sort of person that would do things. I'm totally in control usually of everything. And I start to feel totally out of control. The feelings overwhelm me. And they're feelings of all sorts of things that, wouldn't normally be a problem. Everything becomes a problem. I don't want to go out. Will I be able to do this? I can't remember how to do that. Will I be able to cook that? All ridiculous, irrational things.
Some people recognize normal worries and normal low mood, but it's sometimes unclear when does that become severe or when does it become kind of clinical.
Yeah.
And some people say that there's a quality to a clinical depression that is not just an everyday experience. Would you agree with that?
Yes, I would. Yes, because the other thing is I don't want to eat. I totally just go off food. It's just, sort of an inconvenience really. I don't ever want to just stay in bed and not do anything. I always I always get up, get dressed, shower, etc. And then it's like I've got all day in which to do absolutely nothing because I don't want to do anything or I can't do anything.
So your interest in your normal activities and hobbies is gone?
Absolutely
really.
gone.
And motivation, I assume, is gone as
Yes,
well. Motivation to do it,
totally.
to push yourself along.
Yeah.
Although you do try to keep going in that
I do.
phase.
I've made myself always, yes, as I say, get up. I've not been one to hide myself under the covers and that sort of thing. But
is there anything positive that can come along that makes you feel better in that situation, or is that almost an impossibility?
Yes, absolutely. I would say I get cajoled into doing things probably by probably my dad particularly, who my parents have always supported me through these depressions, having lost my husband, and he's very much one for sort of trying to cajole me along and take me out for a lunch that I probably don't really eat anything. I can't make conversation. I sit there and feel totally inadequate, but they put up with it.
It sounds like the depression is affecting how you feel about yourself and
absolutely
the world around you as well.
Yes, I feel like I can't do anything any longer. I'm not particularly good at anything and haven't got anything to offer to people. This time, my two daughters, I've not been depressed for a long time. They probably haven't seen me as adults depressed, and it upset them a lot because they knew I had depression. I've always sort of told them about it, but they'd never really witnessed it. And this time it was hard for them because they'd come in and visit me. I stayed with my parents. I didn't want to be at home. I couldn't face staying at home on my own. I definitely didn't want to be on my own. That was a big thing, which I didn't mention. But I didn't want to be on my own at all. I needed to be with somebody all the time.
Can you explain what that feeling's about?
I suppose because I couldn't do anything for myself. I didn't feel as though I could, and I needed somebody to be there so that I would be cajoled along, I think. It's partly that. And just scared of being on my own. I mean, I haven't this time had any thoughts of not wanting to be here, but certainly when I was postnatally depressed, I did not want to, I actually did used to think I'd rather not be here. I would never have harmed my baby. That wasn't part of it. It was just that I didn't feel I was adequate. And I can remember saying to my mum once, would you like to adopt Claire? I'll be able to see her, but you can look after her because I won't be able to. And I do also feel as though I'm never going to be the same again. That is an overwhelming thing, that I will not ever be the person I was before.
I think that's a key thing. In depression, you can feel like you're stuck there and there's no hope,
no way out.
No way out and no hope for change.
Yes, that's definitely how I feel.
And
that's probably when I saw you, I think, when I was desperate.
And regarding those thoughts that life's not worth living.
Yeah.
I mean, sometimes that's about feeling that things are totally inadequate, so there's no point. Although sometimes it can be another step beyond that you think, not necessarily you personally, but sometimes people think that they don't deserve to be around. There's no, it's more than meaningless. It's actually like harmful to be around.
Well, yes, and I think the other thing was that I felt I was sort of so dependent upon other people, which I hated really, and certainly for my parents this time, because they are elderly. It was, and yet I could think that, but then I'd think, no, I've got to be with them because I don't want to be on my own. So it was, again, so irrational, really.
Did you have any of the other physical symptoms? You mentioned about your appetite.
Yes.
Sleep problems.
Yes, sleep problems.
Energy in the day.
Yeah, no energy.
Weight issues, that kind of thing.
Yes, I lost a lot of weight because I didn't want to eat. But my mum would painstakingly sort of do me really nice food, and I'd pick at it and eat some, but I just didn't have the appetite to eat what I would normally eat. But I knew I'd got to because of having the chemotherapy. So again, there was that sort of feeling in my head, you've got to, because you've got to get well. And everybody, my daughters would say, come on, Mum, you've got to eat something, and I would for them. So that was slightly different.
So in this situation, the family were definitely kind of trying, they were rallying round.
Absolutely.
But I'm sure that there's families who get frustrated because they don't know what to do in this situation.
Yes.
I mean, from your perspective, looking back on that time now, I mean, what advice would you give to somebody who's looking after a depressed person?
I would say that they have got to have the patience of a saint. And I do remember when I had postnatal depression the first time, my dad couldn't cope with it at all because he'd never seen me like that. And he was totally frustrated. I can remember him just walking out of, I've lived in Brighton then, he just went out of the house and couldn't cope with me, sort of the things I was saying and thinking. And but he'd learned, obviously my parents have seen me go through all this and have learnt, and they are fantastic. They were just excellent with me. As well as my GP, who again pointed me in the right direction each time. And I've had very, very good care always, and medication. The hospitalisation was horrendous, really. At the time I accepted it.
Is this when the postnatal episode occurred?
Yes, but when I lost my husband as well, when I was actually hospitalised for the depression.
For depression, yes. Tell me about that experience, because that's not a common one. Even with depression, of course, most people don't come into hospital with the depression.
No. Well, I had been at home. My parents had moved in with me actually at that point, which was when I was living in Broughton Astley, and my girls were young. They were only 5 and 7, so they moved in to look after the children really. And I got to the stage where I just literally could not swallow food. I didn't want food. They didn't know what to do with me really. I was on medication, and then I really sort of one evening just thought, I don't know what this medication is doing, and I didn't want to take it. And I think for my parents that was obviously a very difficult time. And the next morning I went to see my GP, and she said, I think you really need to go into hospital. You know, it's too much for your parents with the children as well. And actually, I was too poorly to even say, no, I don't want to go. I just sort of said, okay. And, you know, I went into hospital. And it was an awful environment, really, because there were very, very poorly people in a very different way to me. But I witnessed all sorts of behaviour that I'd never come across before. When I was first in there, it didn't sort of matter so much to me, I suppose, although it was a shock. But as I started to get better, I just didn't want to be there. And so gradually, that gave me, I think, the will to get out as well, because I didn't want to be there. So I started to go home and go back to hospital. But I think it was mainly the behaviour of patients who were extremely poorly.
Yes, I think in this country there's a mixed blessing regarding mental health wards.
Right.
And basically, in a nutshell, they tend to be run down, a little bit underfunded and slightly understaffed.
Yes.
And therefore they're a little bit chaotic, and a lot of different type of patients are kind of merged together.
Yes.
In quite extreme situations, you know, in terms of severity, because particularly nowadays, only the most severely unwell patients come in.
Yes.
And so what that means is it's not always, if you're a patient individually, you're receiving care, but you're subject to everything else that's going on with a lot of unwell people. And it can be quite disturbing in a way.
Yes, it was. And I must say I was very, very shocked by it. It was a difficult time. But again, I had lots of visitors, which most of the patients didn't, really. I did. I had visitors every day. And by hook or by crook, they'd get me down to the restaurant or something, you know, in the hospital, and out of that environment for a short time. And even though actually I just wanted to get back to the ward whenever I was out of it, and that's how it felt. It was a very unwelcome experience. But having said that, I can look back on it now, and it's given me a lot more empathy actually to people with any sort of mental illness, because there were people that were sectioned for. I mean, it was the whole dichotomy, and that's it. Yes, yeah.